the outpatients clinic at Bilira Health Centre in southern Malawi. In the maternity unit, nurse Chimwemwe Mapanji is used to working with tablets, but ones that come in boxes of pills, not one that she swipes. Now, with a few taps on the handheld device, she has access to simple electronic medical records for the mother, or can create a new record for first-time patients. Then, with a couple more taps, she can access step-by-step treatment checklists to follow, based on WHO guidelines. This is one of 23 tablets in use at Bilira Health Centre. Perhaps it's surprising to see such high-tech solutions in one of the poorest areas of one of the poorest countries in the world. It's part of a pilot project supported by German Development Cooperation and the Bill and Melinda Gates Foundation to improve the quality of healthcare in Malawi. The electronic patient register replaces paper records and gives health workers like Nurse Mapanji a reliable, cost-effective tool for improving diagnoses and treatment.
When the client forgets his or her profile, he can still come to the facility. We are able to access his or her records using the register. We just log in and search the name of the client. With some few taps on the tablet, you are able to access the records.
The e-register project has so far focused on developing modules for reproductive, maternal, newborn and child health, and another module for the outpatient clinic is currently in development.
We are a typical facility for Malawi. You see, we are in the rural area, so we had also issues to do with power supply. They were a challenge, and also our size, facility size, and number of patients we see. Those were the factors that made GIZ choose Bilira to be a model. Sure.
The e-register is run on an open-source smart register platform, so there are no expensive license updates and it can be customised to Malawi's needs. The unique feature is that it also integrates with the District and National Health Information System, DHIS2.
The OpenSRP e-register is currently in use in only one facility. That's where we are piloting it. But the idea is to have a national rollout of the system, and we believe that it is a great candidate for doing that. It is interoperable with other systems that are in use in Malawi, meaning it can exchange information and speak to other systems. And with that, really provide the clinician with a great picture of what is going on with the patient he has in front of him or her.
That's of huge value since it provides timely, more accurate data. It also enables health workers to make data-driven decision-making at all levels of the health system, from patient care to planning at both local and national levels.
It helps to make decisions quicker because I get reports from one department because I can also log in and check. As they're entering the data, it can be easily summarized and I can check. At management level, you can make decisions quickly because you don't need to call for this and wait for days for somebody to compile using the paper-based system.
The e-register has proved particularly effective in improving child vaccination records. Better information means better planning and less waste of vaccines, which otherwise spoil in the heat.
Using the tablet on that app, before going to the outreach clinic, it gives us, or it shows us, number of children who we are going to vaccinate at that particular clinic, and also number of doses to take to that particular clinic. Whereas before, we are just picking a lot of vaccines and being wasted. But right now, it's a thing of the past.
The biggest challenges for the pilot project so far have been power blackouts and internet instability, which made it hard to use the e-register at first. But now solar panels and backup batteries have been installed at the clinic, and the next phase of the project will focus on further strengthening connectivity.
It was a challenge. It was a new system for us. So, you know, every system comes with its own things. So it took time for us to get used to the system. But with good enough capacity building, currently we are familiar with the system, and so far we are good at it and we are loving it. Sure.